guys. So today we have Katie Mohamed with us. Hi. And she's going to have some procedures done. One of them is lip filler. So Katie's had lip filler done before, so we've been through a consult with you previously, as well as the informed consent process, which is really important, especially when you're doing a medical procedure with a medical device like a filler. And important to remember when you do fillers, and even if the doctor forgets to ask you, if you are prone to fever blisters, let them know beforehand, especially if you're doing lip fillers. And the most recent updating, a trending topic now is the COVID vaccine. So besides COVID and besides that vaccine, if you've recently been for a flu vaccine or any vaccination, please don't have your fillers straight after. Wait at least 4 to 6 weeks post-vaccine. Before that, also if you have an underlying autoimmune condition, if you have a flare-up, just let your injector know about that, because any sort of inflammatory process that's happening in your body can affect. There's a really attractive dip here, and it's very attractive in the female face, but when you do a lip, it'll emphasize this sublabial little crease, so we'll fill it a little. Katie's lips are really very beautiful.
Thank you.
And very nice and soft, so I felt around there's no residual filler, so we just need to reshape and resculpt. We don't have to really fill too much, and she's got really nice anterior projection already, so we don't have to make it go way forward, but it's more to give it a little bit of height. People of color, because dark under eye circles or hollowness under the eyes is very common amongst our ethnic group, and hyperpigmentation is a very difficult condition to treat in this area, so it needs a couple of treatments, and gentle treatments, because if you go too aggressively, it can actually make the problem worse. So right now we're putting on something called the Periocular peel. It's got a whole host of something called tyrosinase inhibitors. It doesn't stay on very long, and Katie will tell you it doesn't really tingle very much. So this is the Miso peel, Periocular peel, azelaic acid, which is it's on trend now, but it's been around for ages for brightening the skin. Also good for acne. Are you right still, Katie?
Mm-hmm.
Salicylic acid, also a small molecule, and it also quickly rejuvenates the skin. Lactic acid's a big molecule, attracts a lot of moisture, so you get hydration. Resorcinol, citric acid, and phytic acid. Phytic acid is also a bit of an antioxidant and helps with brightening the skin. So it's a very nice gentle peel for under the eye. You do it about 6 times. You can space it 2 weeks apart as well. And I'm just doing 1 layer for Katie. It's the first time doing the peel, but you can do up to 2 layers. And with patients of color, you have to be super careful. Post-inflammatory hyperpigmentation, which means post-treatment hyperpigmentation, so we have to be gentle with all our peels. So we're going to do a micro gold infusion for you with depigmenting solution. So it's gold plated needles, and we can mix anything in the cocktail actually. So Botox, a bit of filler, anything that is meant to go into the skin. So this depigmenting solution is the right size to be pushed into the skin just to brighten up. And under the eye, it's very sensitive. It's very thin skin. It's the thinnest skin in the body. So that's why any procedure there can be a little bit more sensitive, a little more uncomfortable than the rest of the face. and that area is highly prone to bruising, so we have to be really careful to be gentle and not bruise the patient. And in patients with skin of color, often the bruising takes a long time to go away, and if it does take a long time, there's something called hemosiderin staining, so it can look brown for a bit. So that's why gentle stamping is important. I'm going to do this Hydra jelly mask on for you. It's my favorite new thing at the moment. I like it because it's super calming, and also it's nice when we put the patient under an LED, so we completely cover their eyes, and it's very soothing. But you're not claustrophobic, are you? You're just going to put it over your eyes?
It depends. No, I'm not.
Oh, you're not? Okay. And it peels right off, so it's not going to rip off your hair or anything like that. So I even mix the mask with the hypochlorous because it's pure, it's super pure and really calming. Niacinamide in it. Niacinamide is vitamin B3, glutathione that people know as the master antioxidant, and it's got a bad rap for skin lightening, which it isn't really for. It's more of an antioxidant. So it really calms the skin, especially skin that is prone to hyperpigmentation. But there's loads and loads of these masks. Some have goji berry, some have like the green shake, super greens. There's one with CBD as well. Relaxed. So I'm not going too much near the border because Katie's lip is already projecting, so I don't want it to project too much. Go, Katie. Torch her over, eh? We don't. Feel.
Angela, thank you so much. I really appreciate this new improved face. And my Botox, my peel, and my lips, my enhanced lips. So thank you so much.
Oh, thank you, Katie. Thank you for coming here, for trusting me. I really appreciate it.
Always a pleasure. Thank you for butchering me.
Okay.
No, she didn't. She's actually very gentle in the way she does things. So thank you so much.
Thanks, Katie. Cool. Thank you so much, guys, for joining us today, and thank you, Katie, for coming in and letting me, as she says, butcher her. I did not butcher her. I enhanced her features gently. So we did some really nice treatments. We did a periocular peel, botulinum toxin, and some fillers. So it's great that you can do combination treatments to reach your goal. If there's anything you'd like to see, drop them in the comments. Please like and share this video and subscribe. Thanks so much.